Okay, Nistogok Abi Kwik Madaki. My name is Dr. Terrilynn Fox, and I'm the Director of Wellness Program with Blood Tribe Department of Health.
Honoring our ancestors, practicing our Siksikaitsitapi traditions through innovation and vision. What does that mean for you, and why this conference?
So it's an amalgamation of ideas and ways of knowing and being coming together in relation to a proposal I wrote from the Department of Women and Gender Equality. It was a response to the pandemic and continuing the effort to break down barriers, create awareness and education on gender inequality. So what did that mean to me at the time of putting this together was infusing our Siksikaitsitapi ways with Western knowledge systems and creating awareness for members about gender roles and responsibilities from our ancient teachings and how it is today. Utilizing elders, elder knowledge, ceremonies, and our cultural practices to target this issue. However, we also need to foster in how we teach so that people absorb it versus talking to them or engaging members as we heal from the traumas, historical, intergenerational, and personal.
So when we talk about gender roles, are we talking about like a matrilineal society, looking back at that paternalism that overtook us through colonization and so forth, and also the other gender confusion as well. So can you explain a little bit more about the inclusion of gender roles within this innovation and vision?
So we need to understand where we've come from. So having our ancient ways as our foundation and having a ripple effect from that in each century. What were the changes? What added to the change in our culture, which was Western thought and theory, intentional teachings of Christianity, of the other cultures, and this system we were operating in intruded on our Siksikaitsitapi ways of knowing, being, and doing. So when we talk about gender, when we talk about those roles and responsibilities, we want to understand why the inequality, why the discrimination, why it's paternalistic. And so those come from other teachings and not our own. Some of the teachings that I've heard from elders was that men and women have specific roles, that they worked in collaboration with one another. It wasn't superior or inferior, it was how they survived. And that's key for us to understand. They worked together. But when colonization, those ways of thinking intruded and trickled into our naturalness of who we are, that's where we see the discrepancies and the inequalities. They're exacerbated at present. And we want to ensure that when we're teaching about Blackfoot ways of knowing and being, that we are teaching factual, cultural knowledge, and we're teaching it in a good way, and we're engaging those we work with so that we're not just telling them, we're asking and inviting them share your knowledge as well. So it's reciprocal, which is part of our ways of knowing and being. It's that exchange of energies, that transfer of knowledge. And combating that in contemporary society, to understand where we've come from, where we are today, and where we're going, it involves everyone. So it's crucial that we have technical knowledge as well as cultural knowledge, but the innovation and vision is key. How are we going to capture that? And I didn't know at the time, and we still don't know, but we are doing what I think I meant to do when writing this proposal. And during a pandemic, during an opioid crisis, on our reserve. So kind of looking at all angles and having our cultural knowledge systems, our language, that is part of everything we know, as key and at the forefront of how we're moving forward within this project.
Mm-hmm. It's all about creating connections.
Yes.
Connections to the past, present, and hopefully the future,
Yes.
the journey,
Yes.
right, towards wellness, right? Talk a bit about your presentation today. One thing that struck me was the word connection, disconnection.
Mm-hmm.
So tell us a bit about your presentation and I guess the purpose and goal of that.
Okay. So the presentation was on the historical, path of gender inequality related to Indigenous women and girls. So very technical, very historical, looking at policy that somewhat shaped us as First Nations people, specifically First Nations people. And some of those policies included the Royal Proclamation, very early on the Doctrine of Discovery, and disenfranchisement, and the Indian Act. And for 150 years, we knew the Indian residential school, right? So we're all affected in some way, shape, or form. So in order for us to understand why we have those who choose to use some sort of substance or alcohol, why the pain, why the suffering, where did this trauma stem from? It's deep rooted in that web. So we have to understand it, and sometimes it's going to uncomfortable places, painful places, but that's where a lot of healing occurs. So my presentation broadly spoke of the 500 years to where we're at today, infusing that with our Siksikaitsitapi ways, our culture, our language, our elders, our teachings, akukas, and deep connections that we hold in high regard, because as social beings, that's what makes us go round. Because we're social beings, connection is key, and physiologically, when you are connected, the hormones that are released in that, they're healthy, they're good feelings, right? And if we can know that and understand that, we can understand what has happened to us. Now we have tools to say, I have a choice now. How can I move forward? And all the supports are here. So let's connect with those supports and move forward together. It's one thing to talk about it and to share that knowledge. I'm very grateful and cognizant that I could be a user of some substance of alcohol, that my life is somewhat in apathy. And I'm grateful that it's not. And I know that my connections to my grandparents and the culture and how I was loved and nurtured and raised, that I was able to make choices that benefited me, my children, and now I can share that in my workplace with members, with colleagues, and again, that ripple effect branches out and it's far-reaching. Who it reaches, I don't know, but it's reached. It has reached many people.
It's almost like a call to action. When we talk about your audience today, which is primarily the day treatment program clients, do you see this expanding, I guess, to a wider audience as well? Would that be part of your proposal, or is this primarily for the day treatment? Because it's all very technical.
Yes.
Really.
Yes.
Right?
Yes. So the 2-day conference, workshop, training, I don't know, I have to find a Blackfoot word that would match my intention. And when I say my intention, I share it with wellness program employees, what's here, so that they can get my intention. So the participants for this specific session was our day treatment clients. And I chose it so that we can, quote unquote, do this research. Because they've been participants with the day treatment for at least a year, many of them. What else can we do? What other tools can we give them? So that in another year, where are they? Are they back in university? Are they employed full-time? Do they have safe housing? What else can we do? So through evaluation, we can then measure the success, right? And I'm not always so technical, but being a researcher, you have to somehow measure what you're doing, what your goals are, your objectives, your call to action, and how do you measure it? The well-being of our clients, that's how we can measure it. The contentment, the joy, the speaking of their story confidently and honorably, that's how we can measure it. And I have shared this presentation to other audiences, and for community engagement and community connection, we do plan to continue on with big conferences to open it up to the broader community. So yes, we do plan to take it to that level.
And maybe technical was maybe a wrong way to say it, but simply put, looking at those disconnections, disenfranchisements, that interruption of our ways of being and knowing, right? I guess that's what was really the target today, was
Yes.
to take a look at those, put it simply, that this is who we are,
Yes.
where we are,
Yes.
and perhaps why we are,
Mm-hmm.
right?
Mm-hmm.
So when we look at the messaging that we heard today, going beyond your presentation, what were some of the more, I guess, the highlights of some of the messaging we got from
Mm-hmm.
the elders, for example, or from the knowledge keepers and your staff here?
Mm-hmm. So I think key was what you said, connection. Connection to spirit, to creator, to each other, connection to our ceremonies. What does that do for me? The symbolism of the efficacy of prayer, of song, of the smudge, and how it makes us feel. I think we need to verbalize that and allow people to say it's safe to say these things. It's safe to say, I feel amazing after a ceremony. You get this natural high. Say it. Don't be afraid. but many are afraid to say that. So that connection, the language is invaluable to who we are. And if we can have forums and dialogue, speaking Blackfoot and having interpretation, but also allowing people to practice, to say it, I didn't understand that. Can you help me? Can you say it again? Having those safe spaces where people may mispronounce it, and that's okay, right? There's no shame in it, where many grew up with shame, and so they're afraid to take a chance on anything. So that was also key. Key also our identity, being immersed and meshed in our culture, our web of who we are, and collaboration, and getting excited about where we're going now, given all the knowledge that we have, given that many people know where we've come from, the interruption and disruption. But now we can make those changes, and it's working. That's the exciting part. When we return to our ceremonies, when we know our medicine are within our ceremonies and our ways of knowing and being, we get excited. I get excited, and I know my tone has changed because it's exciting to say, what else can we do? Where else can we take this? It feels good, on a personal level, but seeing the individuals I work with doing the work, getting it done, organizing, interacting, and sharing that, it's amazing to see. And so we know that there's this wave of energy that Blood Tribe members have. They're creating the changes we need, utilizing our ancient ways of knowing and being, and that's really exciting. And I think honoring each other. So we're honoring our clients, our students, by hosting them at a hotel venue, by ensuring that they're fed, they know what the agenda is. So they're learning that discipline. They know that they have the support. And that's important, to know that I matter, I'm worthy. Someone did this for me. Isn't that amazing? And so creating small changes, but major changes to some, is also something I heard today. Working with our day treatment clients, you can see the discipline. They were attentive and mindful and respectful, and they took in the sessions. No one complained. They were engaged, and that's amazing to see. The growth, the healing, the change in attitude and behaviors in so many. So that's also exciting, and I'm very proud of all our team and the members that we work with now.
And I guess that feeling, goes a long way, especially when many of these clients and many of these people who are struggling with addiction go through a lot of shunning, a lot of shame, and a lot of neglect, I guess we could say. So I guess this makes them feel good anyway, to have them come to the city and eat and listen and learn, right?
Yes.
And I guess that's what makes this program unique and innovative, hence the award I want to talk a bit about. Okay. Congratulations on the award, the Council of Federation Award for Innovation. Tell us a bit about that award and what that means for you and the program.
Sure. Well, I was shocked when our CEO called and said, "Congratulations, Terrilynn." And he said it so quietly, I thought I had won the lottery, and someone else announced it, right? And I said, "What do you mean?" And he said, "You haven't heard?" And I said, "No." And he put it on the speaker, And there was a board meeting, and some of the board members were there, and he said, well, the wellness program received the award for Council Federation for Innovation in Mental Health and Addictions Care. And, you know, I was, quote unquote, flabbergasted. I had no words to say how I felt. I was just so honored, and, you know, isn't that amazing? And as he read and you read the award and the significance and where it stems from, but that there's only one in each province, and so there's only 13 awarded. I was floored. I was, you know, just taken aback, and just thought, wow, that's so amazing. Our work is being recognized nationally, where we're here just doing the work, like the worker bees, I guess. And you know, recognition is, of course, we're honored, and our work is being recognized and noticed, and even a template is being built so that others can share this with their communities. But, you know, nationally, to have this, to feel this, is quite an honor, because what we're doing is returning to ceremony, and having that as our foundation as we move forward in all that we do with our programs and services at Wellness Program. And for me, that's important. I'm a researcher and a lecturer, a writer, and all of the knowledge about culture. It's like, I'm gonna do this. You know, if I go back home and I work, this is what I'm gonna do. In my lectures in sociology, I can just, you know, there's so much energy when we talk about culture, when we talk about First Nations people, Indigenous ways, and it's exciting, you know, because that's what I know. My DNA, my genetics, that's what I know. And to be able to create programs innovatively, but grounded in who we are as Siksikaitsitapi, that's honoring our ancestors, and that's saying our ways worked, and they're going to work again, and that's how we're going to move forward.
Any last comments on practicing our Siksikaitsitapi traditions through a venue such as this conference?
Well, I just invite people to come check us out. You know, take a tour of our building, you know, give us a call, and we're willing to share. But I just want to say, you know, a shout out to the team I work with. They're amazing. They go over and above, you know, the 8-hour work day. You know, many work more than that, and they don't always clock the time after hours or weekends. And that's, you know, they're working from the heart. It's genuine. It's wholeheartedly giving, and how they feel their tank is they fill it with self-care and other ways to continue to do the work that we do. We serve our members. We are public servants, and we hold that in high regard, because we're privileged to have a job, but it's doubly privileged to work with our members and do what we do in addictions, in mental health, in community programming, enmeshed within our culture, moving forward with tools that we've gathered with Western ways. And I think that's the balance, and that's key moving forward.